So the scope of the training is really to equip all the participants on the different steps in setting up these activities. We go through everything from engaging a community to consulting a community. We look at how you design and select the different activities that you will do, finalizing that, and then also in the end delivering it.
This is something that we've been advocating for as an African continent. We'll be looking forward to a time when we could be convened with other experts from other national societies to get to share what we do as we respond to different disasters. As you know, Africa is one of the continents that really gets hit by epidemics and outbreaks. So for us to get here, to gain the skills, to enhance our necessary skills, I think it's something nice because we're learning from each other.
It's very important to share our experiences on how we provide MHPSS, mental health and psychosocial support to the affected population in the field. It's also very interesting to see how we have different way of engaging with community, how we design our project and program, how we do a follow-up and monitoring, but also it's interesting to see what we don't do the same. We really learn from others, and it's a training that we reinforce our capacity and will help us also when we will be back in our respective communities and countries to improve what we do already.
I found a lot of development and innovations in the way we can use the community-based psychosocial support, and more especially engaging the community, taking the community to take the ownership of the project whenever we are doing anything in relation to the community and the MHPSS, and also the great colleagues that are in the training, more experience. The training is more of a practical way of administering the training, which help us a lot to understand the processes rather than theory. It's more of interacting with other colleagues, role plays, and so many other things. So we have learned a lot in engaging community and in getting the right result at the end of the community-based psychosocial support.
I think this particular training comes in handy as we do integration of mental health into existing and new programs that we have for Kenya Red Cross. And one of the things that we are learning out of this is that the communities have their own strengths in place. So as we go in, we are not only going to provide solutions, but to find out what are their strengths and how we come in to leverage on those strengths, as well as look at the risks and vulnerabilities that are in place, but to first recognize that the communities have a lot of strength and resources in place.
Hopefully we will see a lot of activities in the future. This wasn't necessarily a TOT, but it is a training package that can help the different MHPSS focal points and the participants in this training let the information trickle down to staff and volunteers and the ones who are actually going to deliver community-based MHPSS activities in the different communities.